How's that again? Presents. How the coronavirus spread in the US. Part 1. January 21st, 2020. Everett, Washington. On January 21st, the Centers for Disease Control and Prevention (CDC) confirmed the first U.S. case in a 35-year-old man living in Snohomish County. He had returned from Wuhan, China, to the U.S. landing at Seattle-Tacoma International Airport on January 15th, without any symptoms. He reported to an urgent care clinic with symptoms of pneumonia on January 19th and was transported to Everett's Providence Regional Medical Center the following day. He was released from the hospital on February 3rd after 2 weeks of treatment, including the use of the antiviral drug remdesivir, and went into isolation at home. San Antonio, Texas. The 2019-2020 coronavirus pandemic reached the U.S. state of Texas in January 2020 when U.S. nationals evacuated from Hubei Province, China, and the Diamond Princess cruise ship to Joint Base San Antonio. January 22, 2020. Manhattan, New York. Although the first case of COVID-19 was confirmed in New York State on March 1, 2020, it's likely the virus was present in New York between late January to mid-February, weeks prior to the first confirmed cases, and that the proximate origin of the virus was Europe rather than Asia. January 24, 2020. Chicago, Illinois. On January 24, 2020, Illinois health officials announced the first confirmed case of infection with the novel coronavirus in the state of Illinois. The case was a woman in her 60s who had returned from Wuhan, China, the place of origin of the outbreak. She had frequently visited a hospitalized relative and began to experience symptoms after returning to Chicago. She was isolated at St. Alexius Medical Center in the Chicago suburb of Hoffman Estates. January 26, 2020. Orange County, California. On January 26, the CDC confirmed the first case in California. The person, a man in his 50s, who had returned from travel to Wuhan, China, was released from the hospital in Orange County on February 1st in good condition to in-home isolation. Tempe, Arizona. The first confirmed case of COVID-19 in Arizona was announced by the Arizona Department of Health Services, ADHS, on January 26, 2020. A 20-year-old male student of Arizona State University, ASU, who had traveled to Wuhan, China, the point of origin of the outbreak, was diagnosed with the virus and placed in isolation. 26 days after the initial diagnosis and subsequent isolation, and after repeated negative tests for the coronavirus, the student was released from isolation and has since made a full recovery. February 1st, 2020. Boston, Massachusetts. The first case of COVID-19 was confirmed by state health officials on February 1st. The individual, a University of Massachusetts Boston student, had returned to Boston from Wuhan, China. Upon returning to Boston, he began experiencing symptoms and sought medical care. Franklin County, Ohio. On March 9th, Governor Mike DeWine reported Ohio's first 3 cases in Cuyahoga County, a couple who had returned from a Nile River cruise, and a man who had returned from an annual conference in Washington, D.C., where other cases of coronavirus had been reported. 2 days later, the 4th case, and the first instance of community spread, was confirmed by DeWine in Stark County. Later tests showed the first case was February 1st, that of the Franklin County female in her 60s. February 5th, 2020. Madison, Wisconsin. On February 5th, 2020, the first case appeared in Wisconsin. The patient recently traveled to Beijing. February 28th, 2020. Portland, Oregon. On February 28th, 2020, the Oregon Health Authority, OHA, reported the first case of suspected coronavirus in a resident of Washington County. The patient is an employee at Forest Hills Elementary School in the Lake Oswego School District in adjacent Clackamas County. The patient had not traveled to an infected area, likely indicating that the virus had been contracted within the community. The school district closed the school for 3 days for deep cleaning. The case was confirmed as coronavirus by the Centers for Disease Control and Prevention (CDC) on March 3rd. March 1st, 2020. Hillsborough and Manatee Counties, Florida. Florida confirmed on March 1st its first COVID-19 cases. one in Hillsborough County and one in Manatee County. The Hillsborough County patient is a woman in her 20s who had returned from northern Italy. The Manatee County patient with COVID-19 is a man in his 60s and was in isolation in the hospital and stable. It's not known at this time how this person was exposed. Pawtucket, Rhode Island. On March 1st, the first two confirmed positive cases of coronavirus in Rhode Island were identified. Both patients are connected to a St. Raphael Academy school trip to Italy that had occurred in February. St. Paul, Minnesota. The first positive test is confirmed in the state. The patient had recently taken a Grand Princess cruise and had been on the ship with a known case. The patient was an older adult from Ramsey County and had started having symptoms on February 25th and received medical care on March 5th. They returned home to recover in isolation. At this time, Governor Tim Walz said, "I'm confident that Minnesota is prepared for this." March 2nd, 2020. Atlanta, Georgia. On March 2nd, state officials announced the first two cases. A Fulton County man in his 50s who had recently returned from a work trip to Milan, and his 15-year-old son, Lebanon, New Hampshire. The first reported case was on March 2nd, 2020, of a male Dartmouth Hitchcock Medical Center employee who had recently returned from a trip to Italy, and a second case, a man who had had close contact with the first reported case, was confirmed the following day, March 3rd, 2020. The man with the first case had defied quarantine orders and attended a private event organized by Dartmouth College's Tuck School of Business in White River Junction, Vermont on February 28, 2020. Hackensack, New Jersey. On March 2nd, the eventual patient 0 had a bad cough and heart palpitations, and went to an urgent care clinic where he tested negative for flu and strep. COVID-19 tests were not available at the clinic. A chest X-ray also appeared normal, but the patient's symptoms prompted his doctor to tell him to go to the emergency room for a CT scan. While at the hospital, the patient developed a fever, shortness of breath, and diarrhea. His CT scan revealed he had pneumonia, and shading in one lung gave doctors reason to believe he could have the coronavirus. On March 3rd, he was tested for COVID-19. On March 4th, Governor Phil Murphy and Lieutenant Governor Sheila Oliver released a joint statement announcing the state's first case of COVID-19. The presumptive positive test result in a man in his 30s who had been hospitalized in Bergen County since March 3rd. March 3rd, 2020. Wake County, North Carolina. On March 3rd, Governor Roy Cooper announced the state's first confirmed case. A person who had traveled to Washington and was exposed at a long-term care facility. This person was in stable condition and in isolation at home. Iowa City, Iowa. March 3rd, the first known cases were 3 individuals who had traveled on a cruise in Egypt before returning home to Johnson County on March 3rd. March 5th, 2020. Summit and Douglas Counties, Colorado. On March 5th, public health officials reported the first 2 cases of coronavirus in the state. The first case was a man in his 30s visiting Summit County who had made contact with a confirmed case in California. The second case was an elderly woman in Douglas County who had traveled internationally. Both cases were considered presumptive positives. They had been tested by the state but had not been sent to the CDC for verification. Montgomery County, Maryland. On March 5th, Governor Larry Hogan confirmed the first 3 cases of coronavirus in Montgomery County. One married couple in their 70s and an unrelated woman in her 50s. All 3 patients were on the same river cruise on the Nile River in Egypt. Upon their return, one of the patients traveled to suburban Philadelphia, Pennsylvania, meeting with students. This prompted the Pennsylvania Department of Health and Bucks County Public Schools to temporarily close 3 schools in that district to undergo cleaning. Another patient visited the village at Rockville Retirement Community for an event that had between 70 and 100 people. Attendees of the event were told to monitor their temperature and call their physician or the Maryland Emergency Management Agency if they began to exhibit symptoms. All 3 patients had fully recovered by March 12th. Hogan declared a state of emergency after announcing the state's first positive tests. Las Vegas, Nevada. On March 5th, 2020, Nevada reported the first case of COVID-19. The patient, a man in his 50s, recently traveled to Washington State and lives in Las Vegas. Williamson County, Tennessee. On March 5th, the first case of COVID-19 was reported in Tennessee, in Williamson County. The patient is a 44-year-old adult man and resident of Williamson County who recently flew on the non-stop flight to Boston through Nashville's airport. March 6th, 2020. Oahu, Hawaii. On March 6th, the first presumptive positive case of COVID-19 was confirmed in a Grand Princess passenger who had returned to Hawaii. Indianapolis, Indiana. On March 6th, Indiana health officials announced the first case of COVID-19 in Indiana, and Governor Eric Holcomb declared a public health emergency in the state. The first case was a Marion County, Indianapolis, resident who had attended the Biogen conference in Boston. Lexington, Kentucky. The Kentucky government announced on March 6, 2020 that the state had seen its first confirmed case of the virus in the city of Lexington. The individual had been placed in isolation in an unidentified medical facility. On the same day a state of emergency was declared since that individual worked at Walmart, the community's largest grocery store. St. Louis County, Missouri. On March 6, a woman from St. Louis County tested positive for the virus. A student of Indiana University who had been studying abroad in Milan, Italy. She had flown into O'Hare International Airport in Chicago, Illinois, on March 3 and traveled to St. Louis via Amtrak on March 4. 2 days later, on March 8, family members of the patient violated quarantine, leading Villa Dutchen and Oak Hill School to close. Omaha, Nebraska. On March 6, Governor Pete Ricketts announced that the first presumptive positive case of coronavirus disease 2019, COVID-19, had been reported to the Nebraska DHHS. The case is travel-related. The patient is a woman in her 30s from Douglas County who had returned from England at the end of February. Delaware and Wayne counties, Pennsylvania. On March 6, Governor Tom Wolf reported Pennsylvania's first two confirmed cases of COVID-19 in Delaware County and in Wayne County. The first case was related to domestic travel and the second to European travel respectively. Charleston and Kershaw counties, South Carolina. On March 6, the HEC announced that two women, one from Charleston County who had traveled to France and Italy and an elderly woman from Kershaw County, are under investigation and are presumed to have South Carolina's first cases of COVID-19. March 7, tests for the two women returned as presumptive positive, giving South Carolina its first two cases. Salt Lake City, Utah. On March 6, 2020, Governor Herbert declared a state of emergency. The Department of Health confirmed that a former passenger on the Grand Princess was the first presumptive case of coronavirus in Utah. March 7, 2020, Anchorage, Alaska. The 2019-2020 coronavirus pandemic was confirmed to have reached the U.S. state of Alaska on March 12, 2020 when a foreign national cargo pilot became ill with the virus. Johnson County, Kansas. The first case was reported in Johnson County on March 7. It was a woman less than 50 years old with travel history to the northeastern United States. Oklahoma City, Oklahoma. On March 7, 2020, the first case of coronavirus was confirmed in Oklahoma. The patient is in his 50s and came back from Italy on February 23. He began showing symptoms on February 29. Bennington, Vermont. The Vermont Department of Health announced the state's first case of COVID-19 on Saturday, March 7, 2020. The patient who had limited exposure when traveling out of the country was subsequently identified as being in a hospital in Bennington, Vermont. Fort Belvoir, Virginia. On March 7, Virginia confirmed its first case, a U.S. Marine assigned to Fort Belvoir. He had recently traveled abroad. Washington, D.C. On March 7, the first two cases of COVID-19 in Washington, D.C. were confirmed. The first case was a rector at Christ Church, Georgetown who had not traveled outside the United States recently or had contact with another infected coronavirus patient. He participated in church services on February 23 and March 1. The rector felt better initially, but his condition deteriorated to the point of hospitalization when it was confirmed he had coronavirus. After it was confirmed the rector contracted the virus, the church cancelled services indefinitely. The second case was a Nigerian national who traveled to DC and went to a hospital in Maryland for treatment. Although the second man was being treated at a Maryland hospital, he was counted as the district's second case by the Centers for Disease Control and Prevention (CDC). This ends part 1.